I think that is my cue to start. Good morning, everyone, and thank you so much for joining today's conversation. I'm Emily Campbell, the President and CEO of the Center for Community Solutions. Before we get going, there's a little bit of housekeeping. I know that this will be a great conversation, and it will be available for replay later today on our website and also on our YouTube channel. And I know that we will drop the link into that in a few moments. Closed captioning is available for this webinar, so just select the button that says Show Caption to activate. If you have any issues, type in the chat, and one of our great team will be able to sort of walk you through how to do that. This is set up as a Zoom webinar, which means that all participants are off camera and muted for the duration of the program. So if you have a question, please post it in the chat or in the question and answer boxes, and we'll be sure to share it with all of our presenters. So with that, let's get into the reason why we're here today. We are so pleased to have you join us today to learn about the status of women in Ohio. The fact that the status of women fact sheets were the first major release from Community Solutions after I took the helm was no accident. I'm just the third woman to lead this organization in 110 years, and as the mother of two young girls myself, conditions facing women and girls in our state naturally resonate with me personally. The Center for Community Solutions is a nonprofit, nonpartisan think tank engaged in improving health, social, and economic conditions. We, of course, study issues, but we also actively work to change policy, practices, and perspectives. Community Solutions has become a trusted source of analysis and advocacy, and we have a century-long legacy of pragmatic problem solving in Ohio's health and social service landscape. If you aren't already, I'd strongly encourage you to sign up for our 5 Things You Need to Know newsletter and stay up to date with our work and the issues that we are following. I see many familiar names on the attendee list today, and many of you know that I served for about a decade as the research director here at Community Solutions. During that time, we built our capacity to provide decision support, to compile and curate high quality, timely, reliable data and information, and make sure that we were sharing it with policymakers, social service providers, and community leaders. During that time, we piloted our first community fact sheets, and the response was overwhelmingly positive. We definitely want our work to be useful and used. As the COVID-19 pandemic was unfolding, we saw evidence that the upheaval was having a disproportionate impact on women, and especially mothers. For example, by the end of 2021, as many as 170,000 Ohio women had canceled their plans to take post-secondary classes, and that's about 10 times as many Ohio men that had changed their plans. We saw women removing themselves from the labor force, sometimes by choice and sometimes by necessity, as we all tried to figure out how to best support our families, especially while school was remote. As I and my colleagues traveled the state talking to people for the various research projects we were engaged with, it was clear that Ohio's women were stressed and their reserves were drained. Then the latest data from the Youth Behavior Risk Survey was released, showing an enormous increase in mental and behavioral health concerns among middle and high school students, especially girls. Clearly, it was time to take a close look at the community conditions facing women and girls in Ohio. This latest set of fact sheets builds off of work inspired by former colleague Melissa Fetterman. And what we are sharing today is the result of a strong cross-team collaboration at Community Solutions. I'll introduce you to our speakers, Angela and Susanna, in a moment, but I also want to recognize Policy Fellow Alex Dorman, Communications Director Patty Carlisle, and especially Communication Associate Madison Van Epps, who designed the fact sheets and helped us present this complex data in a way that's engaging and easy to understand. Madison is also the one who merged literally hundreds of individual elements into the cohesive fact sheets you see today. So you will see on your screen in a moment what we will be talking about today. We hope to have plenty of time at the end for questions, but please, as we go through, post questions in the chat or the Q&A boxes as we go through this information. You've heard enough from me. I want to introduce our two main presenters for today. You can see their headshots there and their smiling live faces on your screens in a moment. We'll be hearing from Angela Marr and Dr. Susanna Teese. Both Angela and Susanna joined Community Solutions in 2022, rounding out our capacity to collect, analyze, and present data that illuminates something important about communities. Angela Marr is a research associate who is a master at finding relevant information very quickly and getting to the root of what the data is telling us. Prior to joining Community Solutions, Angela worked as the Grants and Data Manager at the Westside Catholic Center, where she regularly used primary and secondary data to demonstrate support for program funding. Prior to her work at Westside Catholic Center, Angela was a Presidential Management Fellow and a Policy Analyst at the U.S. Department of Housing and Urban Development. She's one of our resident mapping experts, and I'm so excited about what she has planned to present more data via interactive maps. So keep an eye out for what is coming on Community Solutions website. Angela is joined today by Dr. Susanna Teese. She joined our team as a research fellow after completing her PhD in nursing. Susanna has worked as a nurse at Akron Children's Hospital and Faithful Servants Care Center. Faithful Servants offers free urgent health services for those without insurance. So Susanna has seen how things really play out in the health field and how policy doesn't always translate into patient care. Her PhD focused on the social determinants of maternal mortality and medical mistrust among Black women in America. Her research interests include food insecurity, health disparities, and racial justice and equity. She is currently a member of the Youth Violence Prevention Plan and Public Health Subcommittees of the City of Akron's Racial Equity and Social Justice Task Force. So it's my pleasure now to turn it over to Angela to dive into some of the information about the status of women. Angela, you're muted.
Never we each fails. Get one, right? We each get one. Well, thank you, Emily. When we really sat down and started diving into this project in the middle of 2023, it happened to be a group of women at the Center for Community Solutions who gathered around a table and looked at what we put out in 2019 for the status of women and said, what do we want to share again? What is missing from here? What would we like to expand on to figure out what were the relevant indicators for what women were experiencing? And so we took that, and what we wanted to make sure was that these were relevant indicators, and we wanted to find trusted sources. So most of this data comes from the U.S. Census Bureau, the Ohio Department of Health, the Center for Disease and Control, and places like that. But we had to find data that was available at the county level and available by sex. So there are things that we wanted to include that we couldn't find that way, or maybe we found it for some counties, but not all counties. And so what we presented to you is the best that we could find at the levels we were looking for. We were hoping to find the most recent data we could, the most timely data. We ended up having indicators that were all from 2020 or more recent. In fact, most of the data is from 2021 or 2022, which makes sense since we were looking in the middle of 2023 as we started to compile this. And so what the fact sheets we present to you are in two forms. We have county fact sheets. So there's 88 sets of these, one for every county in Ohio. These fact sheets are 4 pages long. And then we also have an Ohio fact sheet that is 6 pages long. And for those of you registered for the webinar, maybe you didn't notice it this morning, but you did get a link to the Ohio fact sheet. It is in the reminder you got today. We're also dropping a link to that in the chat today for you, and it'll be posted on our website later today. The state fact sheet is longer, it's 6 pages, because we were able to include more indicators that we couldn't break out at the county level. So these include indicators around domestic violence, immunization levels, self-reported health status, drug overdoses, maternal mortality, and wage gap by occupations. We were also able to break out some of the data that we have on the county fact sheets by race at the state level. We really were not able to do much racial analysis at the county level because, as we'll talk about, many of Ohio's counties are very homogeneous, and this didn't work for fact sheets across all 88 counties. So at the state level, we have indicators broken out by race for high school graduation rate, educational attainment, older adults living alone, disabilities, and birth outcomes. But both fact sheets include data on the social health and economic indicators that are affecting women. If you haven't accessed these yet, you can find them by scanning this QR code or going to the link that's listed here. I think I might also be putting a link in the chat. But I want to echo what Emily said about our fabulous communications team here at the Center for Community Solutions. They put together a beautiful landing page for this project where you can access the reports, see links to related blogs, or check out the data and sources that were used in the project. Again, Patty Carlisle, our Director of Communications, made sure this data was shared as widely as it could be and it got into your hands. And Madison Van Epps, our Communications Associate, made the numbers into something you want to look at again and again. And Suzanne and I just think that they're magicians. So we appreciate their support on this project. But without further ado, let's turn it over to what you're really here for, to hear what we're seeing and what we have to say about these indicators and the status of women. And to start, I'm going to turn it over to Dr. Susanna Teese.
Thanks so much, Angela. Thank you all for being here today. We're really excited to dive into this and start sharing our data that we've put together with you. Just a note before we get started, we recognize that language around sex and gender is an evolving conversation, and we also know that data sources are a lot slower to change. So throughout this presentation and throughout the status of women documents, you'll see the traditional binary labels used, like male, female, or man and woman, only because that is what the data uses. So we wanted to be consistent in that way. So just a note, just wanted to make that clear kind of going forward. We will start here with our social indicators. So age categories were broken up into meaningful life stages. As people live longer and the baby boomer generation ages, adults aged 65 and over outnumber children under 18 years in a few counties, with many being in the Ohio Valley. However, Ohio as a whole has more children under 18 years of age compared to adults aged 65 and over. This large population of kids makes Ohio a unique state compared to most of the nation. Having a larger population of young kids means that Ohio is in a really unique position to invest in these children through quality early childhood education, combating childhood poverty, and promoting literacy to set today's kids up for tomorrow's success. So the United States is becoming more diverse, particularly in the younger generations. In Ohio, BIPOC residents experienced a growth in the past 10 years to a current level of 22.2%. The largest share of residents continues to be non-Hispanic white at 77.8%. Urban areas in Ohio are diversifying at rates similar to the state as a whole, around 3.6% in 10 years, but rural areas are not, diversifying at a rate of about 0.5% in that same 10 years. There's a distinct difference in the percentage of BIPOC residents in urban areas when compared to rural areas as well. High school education is a key indicator for not only economic success, but health status and well-being as well. Ohio's women in the class of 2021 had higher high school graduation rates than their male peers, and this trend continues throughout almost every county. But despite women being more likely to have a high school education and being more likely to hold a college degree, we are consistently paid less than men. In fact, in every industry in Ohio, women earn on average less than men. This pay gap clearly doesn't have anything to do with education. So we as change agents need to start addressing and recognizing why this pay gap exists. Statewide, sorry, go back, Emily. Statewide, there are more women than men with college degrees at every level, from associates to professional degrees. This remains true for almost every county in Ohio. And in 10 counties, women are actually over 10% more likely to hold college degrees. Across all races, except for Asian, of which there is a 10% difference, women are more likely to have at least a bachelor's degree when compared to men. In our Ohio fact sheet, we were able to break down both high school graduation rate and educational attainment by race, but the county fact sheets just have the comparison between women and men. Ohio women are more likely than men to be registered to vote and to cast their votes in elections. 75.7% of eligible women in Ohio are registered to vote. Voter turnout for the 2023 general election was higher than anticipated, especially in an odd-numbered year, likely driven by statewide issues. And Ohio's women are also more likely to be registered to vote compared to the rest of the nation's women. In Ohio, half of women who are living alone are older adults, compared to less than a third of men living alone being older adults. And this trend continues when we examine different races as well. As life expectancies for women are almost 6 years higher than men, this data does make sense. In the older population, men are also apparently more likely to marry after widowhood or divorce than women, leaving a larger share of older women alone. Worldwide, about 40% of older adults live with extended family, but only 6% of older adults in the United States live with extended family. This means that funding for older adult services and programming is really important, both for the physical and mental well-being of older adults. This map looks at the percentage of older women who are living alone. The darker colors represent larger shares of women living alone and tend to concentrate around urban counties like Cuyahoga, Franklin, Summit, Hamilton, and Montgomery. Their values range from 21.7% to 41% of older women living alone. Women outnumber men 4-1 as victims of domestic violence in Ohio, and men outnumber females by 9-1 as perpetrators of domestic violence. 21 counties had incidences of fatal domestic violence from July of 2022 to June of 2023. According to the Ohio Domestic Violence Network, over half of offenders had prior contact with the criminal justice system. 40% of all deceased victims were people of color, and nationally, Black women are almost 3 times as likely to die as a result of domestic violence compared to white women. 30% of cases had children present at the scene, and the youngest victim was 4 months old, and the oldest victim was 92 years old. 22 youth were killed because of domestic violence, and a rising trend noted in this report was teen dating violence. Teen dating violence will also be a focus of our upcoming Status of Girls report set to be released in March. The data shows that about 18% of high school girls in Ohio have experienced sexual dating violence compared to 2% of high school boys. And now we move on to health indicators. Ohio's women have a very high insurance rate, which is a clear example of how policy impacts lives. However, Ohio's women still suffer from high rates of poor self-reported health, poor birth outcomes, and pregnancy-related death. Ohio's health insurance rate for women is almost 95%, which is higher than the rate for the United States, and thanks in part to Ohio's decision to expand Medicaid in 2014 and the Affordable Care Act. This is a really clear example of how policy changes make huge impacts in people's lives. But it's important to discuss that health insurance does not mean access to care, it does not mean good health outcomes, and it does not remove every barrier to care. It's just one piece that can set someone up to try and achieve good health. As we'll discuss further, mental health, and maternal death are still areas that need a lot of attention. In the table here, you can see that most girls under 19 and women aged 19 to 64 are covered through employer-based health insurance, but also a large portion are covered by Medicaid as well. For women over 65, most are covered by Medicare, with another portion covered by direct purchase or employer-based. And it's also important to note that individuals may be covered under more than one type of insurance, so these percentages may add up to more than 100%. See here that women report having more poor self-reported health days for both mental and physical health. This could be for many reasons. Women live longer, or men may not be as likely to report concerning symptoms. However, given the wage gap between women and men, the fact that women are more likely to be caregivers and more likely to be in poverty, it may just be that women's physical and mental health are suffering. Around 76% of Ohio's women aged 50 to 74 have had a mammogram in the past 2 years, but about half of cervical cancer cases are first diagnosed at late stage. Cervical cancer is highly treatable when caught early through routine pap smears, so the fact that half cases are late stage is a concerning statistic and may imply that many women are not up to date on their annual paps. Mental and behavioral health will also be a focus of our upcoming Status of Girls report for many reasons, but one includes this data right here. Fewer girls under 18 have received treatment for a mental health diagnosis through Medicaid or as reported by their local Adams board. But we know through other data that girls are far more likely than boys to report symptoms of depression and anxiety and have suicidal thoughts and attempts. This data is concerning because through these other sources, girls clearly need treatment, but they aren't getting it. Is this due to access, stigma, stereotypes, or how the diseases present themselves in boys versus girls? Those are some questions that we seek to answer in our upcoming Status of Girls report. There's a lot to unpack in this one data point, and we're looking forward to doing it through that report. You can see here that women over 18 have higher treatment numbers compared to men over 18. So there is a gap there as well, but it's just the inverse of what we see in boys and girls under 18. It's also important to note that as we were putting together these fact sheets, there is a concerning lack of data around mental health, but specifically data that separates mental health by sex. So this is definitely an area of focus that needs to be addressed.
Within the health section, there are indicators dedicated to maternity care access, maternal mortality, and birth outcome data. While not every woman gives birth, for those who do, it is a significant event in their lives with physical, mental, emotional, and financial implications. The map here shows the maternity care access levels in Ohio's counties from the March of Dimes. The dark red are noted as maternity care deserts, and the light red or pink color are low access to maternity care. 13 counties are designated as maternity care deserts, and 4 have low access, for a total of 17 counties in Ohio with low or no access to maternal care. This is 20% of counties. This designation takes into account the availability of birthing facilities, obstetric providers, and insurance coverage. Given the high levels of insurance in Ohio, these designations are primarily a result of the availability of birthing facilities and access to care. Over 40% of counties do not have a hospital with obstetric care. When the March of Dimes compared data in its 2022 report to its 2020 report, which is 2019 and 2017 data, there were more women in Ohio than any other state that experienced reductions in access to care. This represents a trend we're concerned about as access is worsening. This is a barrier to women receiving adequate care throughout pregnancy and birth and can affect birth outcomes for both mom and baby. One of the metrics we at Community Solutions keep an eye on is the maternal mortality rate. Ohio's maternal mortality rate is 23.8 deaths per 100,000 live births. This is lower than the U.S. maternal mortality rate, but we know that maternal mortality rates in the U.S. are drastically higher than in other peer nations. Moreover, they hide racial disparities. This fall, the Ohio Department of Health released the most recent report on pregnancy-related deaths in Ohio. This report covers data from 2017 and 2018, and it is the most recent report. In the past 10 years, 3 different methods have been used in Ohio to calculate pregnancy-related mortality, and these methods differ from the one used nationally by the CDC, which is the one we report on the fact sheets, as it is a more recent number. Due to changes in the calculations in the most recent report, notably that it incorporates unintentional overdose criteria into the review, the data was not available at the county level as it has been in the past. Data from previous reporting covering 2008 to 2016 revealed that non-Hispanic Black women were more than 2.5 times as likely to die from pregnancy-related causes as non-Hispanic white women. The most recent report included the sobering conclusion that 72% of pregnancy-related deaths from 2017 and 2018 were preventable. This report doesn't give us data on how mothers fared during the pandemic. Lack of care coordination and continuity of care was the most identified factor that contributed to pregnancy-related deaths. One of the solutions suggested to address this is using community health workers, and I want to take a moment to mention my colleague Natasha Taki-Micah's report released last month about how community health workers navigate the infant and maternal health space in Ohio. This report is available on the Community Solutions website, and I believe we're dropping a link to it in the chat. Racial disparities persist in data and in the data for birth outcomes as well for moms and babies. In Ohio, Black and Hispanic mothers and babies experience higher rates of inadequate prenatal care, preterm births, and low birth weights. Rates of cesarean sections hover around 30%, with Black mothers having the highest rates of cesarean sections. In the 2021 infant mortality report released this month by the Ohio Department of Children and Youth, infant mortality rates rose overall and in each race in 2021 compared to 2020. In 2021, the infant mortality rate for Black infants was 2.8 times higher than that of white infants. Prematurity, also known as preterm births, was the leading cause of infant death for all races. In a related but better indicator, we are happy to report that births to teen mothers are declining. The rate for the 5 years between 2018 and 2022 was 34.3% lower than for the 5 years between 2012 and 2016. This was one of the most pronounced trends that we saw in the data, as the rate of births to teen mothers declined in 87 counties, with a quarter of the counties decreasing by 40% or more. Reducing teen pregnancies improve well-being for women. Being pregnant as a teenager increases the risks for mom and baby, including high blood pressure, preeclampsia, premature births, low birth weights, infant mortality, and postpartum depression. And of course, being a mom at any stage, but particularly as a teenager, comes with increased financial, emotional, and mental stress. Births to teen mothers increase the likelihood that the mother will experience poverty and emotional complications such as depression or substance use. The decline in births to teen mothers increases the likelihood that girls will graduate from high school and receive a college degree. Which brings us to our discussion of economic indicators. Access to economic resources is a critical component of stability, health, wellness, and agency. Historically, the distribution of economic resources is tied to distributions of power. This legacy of inequality is one of the reasons it is important to continue to monitor and report on the economic status of women. The first step in looking at access to economic resources is to see who is participating in the labor force. Consistently, we see that females or young women between the ages of 16 to 24 participate in the labor force at higher rates than men. But that trend reverses itself as we look at the other age categories of 25 to 44, 45 to 64, and 65 and older. In these other ages, women are participating in the labor force at lower rates than men. We believe this is due to the caregiving responsibilities that fall more often to women, both in raising children and caring for adult family members. It is worth noting that women with children in Ohio participate in the labor force at higher rates than women with children nationally. This is true for women with preschool-age children, school-age children, and both preschool and school-age children. It isn't clear why Ohio mothers are participating in the labor force at higher rates than the U.S. It could be an indication that families in Ohio are not able to make ends meet without moms working. Labor force participation rates increase for women who only have school-age children, likely due to a lessened need for childcare once their children are in school. Childcare is a perennial struggle for families, and evidence suggests this challenge has only worsened in recent years. We struggle to find comprehensive, timely data about the cost, availability, and access to childcare throughout the state. The most comprehensive childcare data available is from 2018. At that time, 39% of all Ohioans were living in a childcare desert, which is defined as an area with 3 times as many children as licensed childcare slots. The pandemic and inflation have only exacerbated the challenge and burden of securing and affording childcare. In these fact sheets, we report the number of children under 6 where all parents in the household work and will therefore need some form of childcare. We will be taking an in-depth look at what data is available around childcare in a future blog. We found that women who are able to work consistently earn less than men, as we've already mentioned. There's a wage gap between men and women in every county in Ohio. The map shows the wage gap in each county, with the darker counties having the highest wage gap. In those counties, women earn 59 to 69 cents for every dollar men earn. The lighter counties have the smallest wage gap, with women earning 80 to 92 cents for every dollar a man earns. Median earnings for women who are in the labor force full-time year-round in Ohio is $44,230, which is 75.8% of the median earnings for men. Although this is still a significant wage gap, the gap between what men and women earn working in the same occupation has shrunk by 2.4% in Ohio in the past 5 years. However, in 29 of Ohio's 88 counties, the overall wage gap actually widened in the past 5 years. As is already mentioned, in Ohio, there is not a single occupation in which women earn more than men on average. The occupations with the smallest wage gap between men and women are community and social service occupations, art, design, entertainment, sport, and media occupations, and food preparation and serving related occupations. Each of these occupations is at the lower end of earning potential, with food preparation and serving related occupations having the lowest median earnings. Conversely, the occupation with the highest median earnings is legal occupations. Legal occupations have the highest wage gap between men and women, with women in legal occupations in Ohio earning only 57.3 cents of every dollar men earn. Conversations about closing the wage gap or parity in men and women's pay need to consider not only the disparity within an occupation, but between occupations that are disproportionately held by men and women. Given the barriers to employment and pay parity, it is not surprising, but it is disheartening that women experience poverty at higher rates than men in Ohio. This map shows the overall rates of female poverty at the county level. In the lightest blue counties, women are experiencing the lowest rates of poverty, between 5.1 and 8.5%. The darkest blue counties have the highest rates of poverty, with at least 17% of women experiencing poverty and up to a quarter of all women experiencing poverty. Across the state, poverty rates are similar and highest for boys and girls under age 18, but higher for women in all other age groups. The disparity is greatest in the childbearing years of ages 18 to 44, with 17.3% of women in this age group living in poverty. Additionally, female-headed households experiencing disproportionate levels of poverty in Ohio. Looking at the chart, the left-hand side shows the share of all households in Ohio that are married, male-headed, or female-headed. The right-hand side of the chart shows the share of households in poverty in Ohio that are married, male-headed, or female-headed. In Ohio, female-headed households make up 32% of all households, yet account for 59% of the households in poverty. This 27 percentage point difference between the share of all households and the share of all households in poverty is the disproportionality. This difference is present in every county in Ohio. The map shows this difference, with the darkest blue counties having the largest overrepresentation of female-headed households in poverty. This map is almost a negative of the overall poverty map, indicating that where the disparity is greatest, there are lower overall poverty levels for women to begin with, and where this disparity is smallest, there are high levels of overall poverty. In every county, female-headed households with children are experiencing poverty at higher rates than female-headed households without children. Female-headed households are more than twice as likely as all Ohio households to live in poverty, and female-headed households with children are 3 times as likely as all Ohio households to live in poverty. We know that poverty is correlated with most, if not all, poor outcomes, from health to education to mental health. The fact that women and children continue to experience high and disproportionate levels of poverty in Ohio sets individuals and the state up for challenges with intergenerational poverty. And that concludes our very quick overview of the data and the trends. And I know we threw a lot at you, and we are looking forward to hearing your questions and continuing the conversation.
Great. Well, thank you to both Susanna and Angela for sharing an enormous amount of information in a clear and concise manner. For those of you who are listening in, please feel welcome after it's posted this afternoon to go back and check out the recording, to jot down some notes or have additional information. I want to emphasize again that we have shared statewide trends today in a lot of the data that do come out of the Ohio fact sheet on the status of women that we're releasing now, but we also have a fact sheet for each and every one of Ohio's 88 counties that has data specific to indicators related to the well-being of women and girls for each county in the state. So would definitely encourage you to take a look at the data for the community that you are working in. Before we turn to questions, I want to formally thank Angela and Susanna for their presentation. And while I have the mic, before we turn it over, I'd be remiss if I didn't mention a few things which will be coming from Community Solutions. And let me stop my sharing while I do that. Okay, here we are back again. Next Friday, I'll be speaking at the City Club of Cleveland about how to propel the region and its people forward. Hope to see many of you there. Online ticket sales close for that next week on January 31st. As has been mentioned a couple of times, building off the work on status of women, we're currently working on a companion report, Status of Girls, which will dig deeper into some of the data on girls, teens, and young women with a special focus on the areas of behavioral health and well-being. Our next plan set of fact sheets will look at conditions in Cleveland's neighborhoods. With the generous support of the Cleveland Foundation, Community Solutions will be expanding our ability to produce local area estimates of indicators that matter for locally significant geographies like neighborhoods that don't line up with the census boundaries. And finally, the Center for Community Solutions will be launching a new website probably next month. I've had the opportunity to get a bit of a sneak peek, and it will be an enormous leap forward in making our work so much more accessible and easy to find. So please be sure to subscribe to 5 Things You Need to Know in our other newsletters for information about what is coming next. So with that, let me turn it over to the chat. A question about the data that we were able to find, and I'm not sure who this should go to, but I'm just going to ask it. Were you able to find data on justice involvement? For example, how many women are incarcerated in jails, prisons, or on probation or parole? These are major health-related social needs and overlap with mental health needs in the state. So any data on justice involvement?
That's a great question. And I mean, Dan's right. Like there is a lot of overlap with that. I will say justice involvement did not come up when we were sitting at the table talking about relevant indicators that we wanted to explore. But it's something I think we will keep on our radar to look into further.
Yeah, and I can say that in the past, when we've looked at justice involvement, the data was scattered and not consistent over communities. In the larger counties, we tended to have better data about justice involvement, but that is certainly something that intersects with all these issues, as Angela mentioned.
I think
Thanks
that's
for that.
something though that it's a finding from the project that we also wanted to highlight is what's missing. So that's a good thing to point out as well, and something we hope to elevate in these conversations.
Absolutely. All right, a specific question about the slide showing mental health treatment. In regard to the slide showing slightly fewer girls got mental health treatment despite their increased reporting of symptoms of anxiety and depression, what are your guesses about why that is? Are boys just showing more disruptive externalizing behaviors that are more likely to get treatment? Other bias? Susanna, maybe you can talk a little bit more about that data, or I'll jump in. Okay, I'll just jump in and talk about it. So on that particular slide, what we were showing were the number of people by sex that were either treated by the public behavioral health system, by the Adams boards, or by Medicaid. So it is focused on the public treatment system for behavioral health issues. And the short answer is we don't know. It's something that we were surprised to see and something that we're trying to find more information about. I can tell you that when we look at some other data about children's health and diagnosis, we do see a difference in what is being diagnosed for boys and girls, and even by different races. And I think it does have to do with how certain kind of acting out type behaviors are perceived and seen. So this is an area where we have a lot more work to do to look into, but a place where we see a mismatch and we really need to understand why, because it is something that is concerning. So thanks so much for that question. All right, moving on. Do legislators in Ohio respond to and utilize your data in making policy? I understand that you are nonpartisan, so may not be able to speak to which party responds. Perhaps you have more of an impact on nonprofit resource direction. Yeah, great question. You know, this is what I will say about that. So the Center for Community Solutions is nonpartisan. That doesn't mean that we don't have a point of view. It means that we believe that good ideas can come from anywhere and that bad ideas can come from anywhere, and we try to work with anyone that is interested in our issues. I will say that that my experience has been that there are differences between individual legislators that play themselves out, and there's more variety within each of the caucuses than there is between the two caucuses, the Republican and Democrat caucus in some ways. But you know, we've had the opportunity to work with people on both sides of the aisle and share this data and information. And the reason that we keep doing it is the more we can present the statistics and the information about conditions in folks' local community that kind of reflects the reality that they may be seeing around them, it's really helpful. And this is the reason that last year we released fact sheets for all of Ohio's legislative districts, the state legislative districts, so that we can go into legislators' offices and say, here's how many of your constituents are relying on some of these public benefit programs. Here are some of the conditions that are facing people. So, you know, it is a challenging political environment for some issues, but everybody's looking for solutions to problems and to try and move the state forward. And so we look for common ground wherever we can find it. But yeah, sometimes it's frustrating. And you're exactly right that there are times when the movement is faster when we're talking to some nonprofit or service provider partners that are able to implement changes perhaps more quickly. All right, next question. Curious if we came across data that would point to the success of decades of programs for comprehensive sex education and access to birth control as reasons why the teen birth rate continues to drop so precipitously. I think there is a lot of credit due there.
So I will say the fact sheets for me they're like the starting point for these conversations, right? Like we've now been able to say like, this is what we see. Okay, why is this so universal in Ohio? And I think, Julie, that's something we can look at. You know, if you and I want to look into that, or you and Susanna and do a blog about it, we can do that. But that's what we hope from these fact sheets, right? Is that change agents, decision makers, community partners will use these and look at them and find what resonates for them and do something with it. You know, figure out why that we're seeing what we're seeing, or what we need to do in reaction to what we see here. But I mean, I imagine that you are more knowledgeable about that area than I am, Julie. So I think your guess is probably a good one.
And Julie, that is an area of focus, sexual health, that will be an area of focus for our upcoming Status of Girls report. I hate to keep plugging that, but we really will be able to dive deeper into a lot of these topics. So that is definitely an area of focus for that. So stay tuned.
Yeah, isn't it nice when we can point to something that that has worked and is working, and we see it in the data? And I think we all in our heart of hearts understand that having strong reproductive health education, having access to family planning, so both people who want to get pregnant can, and those who don't want to, don't need to, has been something that's really affected this. But the trend of reduced teen births is something that we see across the country, and an area where Ohio has certainly had some success in the last few decades. We definitely want to point those out. All right, next question. Do we have any thoughts on why women in Ohio are participating in the workforce more than women are nationally?
Yeah, this was specifically women with children, and I can't give you a definitive answer. One of my trains of thought that I'd like to explore is, is it that it's harder to make ends meet here, or, do we have more single family households, and therefore you only have one earner who has to be the breadwinner. But it is definitely a finding that's worth looking into more. Emily, do you have thoughts?
Same thoughts.
Okay.
Same thoughts, thanks. What do you believe are the main factors that contribute to the wage gaps that still exist between men and women, especially given the fact that women have higher education rates compared to men, right? So this is one of those areas where the data doesn't quite make sense, or it doesn't flow logically from one indicator to the next. Angela or Susanna, do you want to talk about that, or would you like me to take it?
I mean, my first gut is that it still has a lot to do, even though not every woman's a mother. I think we're still seeing a lot of women who make choices to be caregivers and have to, leave and come back. I just, even in like my own journey, like I think you lose that longevity at some place, you lose more of those moves that help you sort of move up the ladder or network more. So personally, I think that's part of what's reflected in it. I don't know that that's the whole story though. What do you think, Emily?
Yeah, I think that definitely plays a role in it. It also has to do with what we're really what we're counting in this data. So that data looks at by occupation group, full-time workers, and their average wages. And so I think the legal profession is a great example. If you think about the legal profession, you have everything from paralegals whose earnings are much lower, all the way up to the best paid, well-heeled partners and big law firms, and everything in between. there's still maybe not a glass ceiling, but women are underrepresented in the highest echelons of power in most industries, and certainly when we're thinking about government and some other areas. And so I think that that has quite a bit to do with it. We also see it in the healthcare field. When you think about who are the people that are working as home health aides, which are some of the lowest paid or the lowest paid people in the healthcare industry, it's a lot of women and it's a lot of women of color. And so we are seeing both gender and race and ethnic wage gaps. And I think all of that has to do, it has to do with caregiving, it has to do with education, and advanced education is required for a lot of those higher paying jobs. It has to do with, challenges in getting and finding work, some of the things we hear about women not asking for raises or not applying for jobs that they would ordinarily qualify for. So a lot of different factors that are playing in to this issue, and really has a lot to do with what are the specific jobs that different groups of people are more likely to be working in,
Mhm.
and what do those specific jobs pay. But the evidence, there's a preponderance of evidence that there is challenge for women, or women that take a step back from their careers or from their earnings when they have children. And the opposite is often true for fathers. So something that we definitely need to take a look at, and that's close to all of our hearts too. I want to see, I think there were a few more questions that came in through the chat. Let me see if I can get them here. Okay. Curious on when women go back into the workforce with school-age children. School
Mhm.
schedules are not friendly to women with typical work schedules. Does the data break this group by the age or the grade band of children? Right. The short answer is no.
No.
No, it doesn't. But I can tell you from other things that we're seeing is that it's often when the children do get a little bit older and are able to stay home alone. I think that makes sense. If you still have an elementary student, if school's canceled, you got to figure out a way for to be with them, or to have care provided for them. And so in other studies, what we often see is women returning to the workforce or even going back to school when their children do. So when their children hit high school, or even mom and son or daughter go off to college at the same time, and are working on the same trajectory there. So our data that we used from the Census Bureau doesn't break it out. They just say school age, and it's a wide band. It's ages, I think, 6 through 17, if I'm remembering correctly. But other evidence and anecdotal information does show us that, the older the child, the more likely the person is to have gone back to work. Okay. Let's see. Is there data to support pay disparity in public education between men and women and by racial background? I'm not pay disparity. Susanna, Angela, do you have a thought about that?
Not where we were looking, and specifically for Ohio, I don't think we can get that, but I'm wondering if maybe there's a national data set specifically for public pay, but that's so state controlled. I don't know.
Yeah. I mean, it's an interesting question and something we can take a look at. It does bring up one of the challenges that we found in this data. So many things are available by either race
Mhm.
or by sex and
Yes.
gender, but finding things for both race and sex and gender really reveal, I think, some of those important things about communities, but is very difficult to come by. So one of the things that Community Solutions is actively doing is advocating with groups to make more data available, both public data and some of the other kinds of data, so that we're able to take a look at how different conditions are impacting different parts of our community in different ways. Clarifying question, the legal pay disparity data took into account all jobs associated with law firms, so the female docket clerk salary is figured against the male senior partner's pay. Yep, it's the whole industry overall. And so that is something that is factoring in. And looking toward Ebony, who's running things in the background for us. Thank you to Ebony Thornton. Want to see if there are other questions that I may be missing as I'm clicking back and forth, and I am not seeing any. All right, and thank you to Suzanne Ziller for posting another resource in the chat there. Okay, another question. Does this data take into account the immigrant status of the survey participants, especially given that there is a large number of the refugees in the Akron area? The short answer is nope.
Yeah, I mean, and there wasn't like one survey that we used. I mean, the survey data that we did use, like from the census would be the American Community Survey. I think some of the health data would have come from other survey instruments, but they didn't break anything out by immigration status.
Great question. And I think that's actually a good kind of place to perhaps end some of our conversation here, is that we've presented data that aggregates things together. We know that each individual's experience is different, and especially in a place like Ohio and Ohio's counties, the county level indicators can obscure some of those differences between communities, between geographic areas, between men and women, between people of different races. And so our hope is that those of you who are working on these issues are able to take this information, learn something about your community, but also see what it means for the people that you're serving on a daily basis. And where are those areas that more investigation would be helpful, more evidence would be helpful, and please do let us know. As I mentioned, we at Community Solutions very much want to see our work be useful and used. And so if you find the status of women fact sheets useful, please drop us a line and let us know how you were able to use it. We get great, great satisfaction from hearing some of those things, and we don't always hear it. As a reminder, this webinar has been recorded. It will be posted on our website and our YouTube channel, hopefully later today. One more question. Okay, here we go. Are we working or have collaborations with community health workers? The answer is yes. Those collaborations are deepest where our main office sits in Cuyahoga County, and our colleague Natasha has been working hard to make some of those connections. Community health workers are so important to address so many of the issues that we see in the data, and I see Susanna nodding her head, as she well knows. And where can I access more data related to working moms and caregivers? Angela, suggestions?
I mean, caregivers is one of those that we don't have as much as we'd like to have. There was a link to, I know a caregiver blog I did a few months ago, which is again looking at more like overall trends, not if you're looking for a small geography. I can't really point you to a good source for caregiver data on a small level, local level. Working moms, yeah, I don't have one off the top of my head. Like we just looked at Census Bureau numbers that showed women with children, different ages who are working. But there's certainly topics worth exploring, and they're ones that we're trying to work with community partners to talk about more. So if you want to reach out, my email's on our website, or it's on that landing page at the bottom of the Status Women webpage. If you want to talk more and we can brainstorm ways to look at this issue, I'd be happy to continue the conversation.
Yeah, the other thing that I might point to is a real untapped resource for data. Unfortunately, it's only by the state level, so it doesn't break down any further than the state of Ohio, but it's the US Census Bureau's Household Pulse Survey. They ask questions about like why people aren't working and so some other issues about caregiving, both for children and for other family members, adult family members. So that is a place that we can look at. But if you have specific questions about data points, please reach out to any of the members of our research team. And if we have something, we'll be happy to share it right away or kind of talk through what may be available. So with that, I think we will conclude our webinar. Thank you to all of you for joining us this morning. Thank you to Susanna and Angela for sharing such a wealth of information in a short period of time, and look forward to seeing you out and about as we continue this important work to propel Ohio forward. Thanks so much.